A quiet revolution is happening in South Devon and Torbay. An award-winning care trust is changing people's lives for the better. This is some of the most beautiful countryside in Britain, from remote moorland communities to busy seaside towns. Here, innovative healthcare is attracting international attention. Over the last decade, the Torbay model of care introduced a fictional character, bringing in services to suit the most complex needs for Mrs. Smith, her family and her friends. The Trust Board led the way to bringing together health and social care, a pioneering path towards the future of modern healthcare. Working with partners, including GPs and local authorities, every working day, teams of health and social care professionals help to deliver the vision for the people they care for. 9 local hospitals from Dawlish to Dartmouth, Brixham to Bovey Tracy offer a wide range of services. Newton Abbot is the latest and largest community hospital and hub, providing specialist care closer to home, helping people to live better and maintain their independence. The Chief Executive and her team recall the journey.
The vision was based around a fictional lady called Mrs. Smith, and we told a story about the services that she received, which basically was that they were fragmented, they weren't joined up, and in isolation, the services, or individually, the services were doing an excellent job, but they weren't joined up around Mrs. Smith. So our vision was about how do we join them up, how do we join them together with supporting the family and carers, supporting secondary care and Mrs. Smith with an integrated care record. And so our vision was about how do we join it all up around Mrs. Smith and her family to allow her to stay independent and living at home.
We started off in Brixham Hospital, and then in the very early days we were moving into Bryce and the Brysham unit. So there was a lot of work going on there and a lot of organisation of getting the nurses to come into the teams and the NTs and the physios. And I think everybody was quite a little bit resistant to it, or a little bit apprehensive about what it was going to be like, because up to that point nobody had ever worked together.
The beginning was an incredibly exciting time, and I think that was what I'd really like to say most. But when I was first interviewed for the post, it was quite a daunting experience. It was at the Grand with an audience of 50 and a cinema-sized screen to do our presentations on. So it sort of felt that this is something really big, something big and exciting.
We had a mythical lady called Mrs. Smith who had a lot of complex care, and we arranged our sort of coordination around her, used her as a sort of a model for what we would want for all our patients.
Every single thing we do focuses on Mrs. Smith. So for me, her experience can only have been improved by being part of this whole community. The vibrant approach to actually looking after Mrs. Smith and concentrating all our resources on making things right for her must have had a huge impact. And I know that from my own family's experience, because we've actually had care ourselves within this environment of the Care Trust, was absolutely fantastic.
The concept of using Mrs. Smith had far-reaching consequences.
So it was a very exciting time to be a part of the Care Trust. We never formed the Care Trust because we had an organisational form in mind. It was about trying to simplify the processes that staff had to work with on a day-to-day basis, and then it sort of evolved that actually some of the complexities of organisations working together would be simplified by a single organisation all coming together.
We are very clear that the reason we're here is to provide seamless care
across multi-organisations and ensure that we can provide the best outcome for Mrs Smith, be it in her health or social care needs. And I think that's been a really valuable picture for our organisation and for the individuals who work in it.
I first got involved when my wife was ill with dementia, and the problem of trying to draw services from different areas was immense, was the Care Trust. A lot of upheaval in the beginning, didn't work terribly well in the beginning, which you would expect, a lot of change, but eventually, and very quickly actually, it came together very well.
When we started, we didn't know that we would deliver the outcomes that we did deliver. When we started, we just believed we were doing the right thing. We were putting Mrs Smith first, and we were helping our staff to support Mrs Smith, stay at home, keep independent, to reduce all the bureaucracy and just do the right thing. And it was only much later when others outside of the organisation looked at what we were doing and some of the outcomes we were delivering that we realised that what we were doing was so special.
As a physiotherapist, I was used to working across different teams, thought I worked very well across teams, but the Care Trust challenged my thinking. What I was bringing was a physiotherapy assessment and information when we were reviewing a person's issues, but actually what the Care Trust wanted was shared solutions, shared problem solving, and I was being asked to contribute on the whole aspect and the whole issues that that individual had, and to be part of finding the solutions for that individual.
The important thing was, I think, that looking back, was that the success lay in what we were doing and that it was quite unique.
It was really wonderful to find an organisation where they genuinely were patient-centred. They're caring about the staff, but throughout all of the staff that I've worked with, the focus is absolutely clearly patients, and that's refreshing, and it was inspiring.
I've always felt that it's a very open organisation, and I've always felt valued, and I'm actually part of the organisation because I work across lots of different areas. That what I'm doing is actually making is helping the organisation or making a difference.
The reputation of the Care Trust when I was working in HS Devon was superb. It was an organisation that was thought to be very caring. It was an organisation that was well led, and it was an organisation that people actually wanted to work for.
I found it really positive, plenty of opportunity, enjoyed the bringing together of the two finance team, because I worked in finance. There's a social care finance team from the local authority and NHS finance team for the PCT, so I found it really positive.
Our future is about doing even better than we do now for the people in Torbay and Southern Devon. What we want to do is to see everything being joined up and improving so that we can efficiently deliver the great care that we do to everybody in our area.
Finding the way through the complexities of health and social care did indeed require real joined-up thinking. The vision needed a bold plan, a plan that required a new way of working. Celebrating 10 successful years, what was the essence of the journey in one word?
The important factor was one vision.
Well, it was challenging but very exciting.
Like a family.
Valued.
For me, I think compassionate.
Shared problem solving.
Exciting.
Doing something different because it felt like it was the right thing to do.
Visionary.
Being Irish, I'm going to take two words. One is care and the other is trust.
Caring and inspirational.
Passionate, enthusiastic.
It means a passion for great care.
The solution became increasingly clear. One vision, one future, the merging of the acute and care trusts. So what legacy can Torbay and Southern Devon Health and Care Trusts leave?
My hopes for the future is that what we hold dear here at the Care Trust, so keeping Mrs Smith at the centre of everything we do, continues into the future, and that we keep Mrs Smith at the centre of her life, her choices and her care, and keep her well and independent at home for as long as possible, and that we'll be able to do that more with access to specialist care closer to home.
A future only made possible by the dedication and determination of everyone involved.
I want to say a big thank you. A big thank you to all my colleagues in the Care Trust. A big thank you to my board. And a big thank you to all the people in Torbay and Southern Devon who have supported us over so many years to deliver our fantastic service.